Welcome everybody out to Utah in the Weeds. This is episode 93. We are coming up on 100. 7 more episodes after this. Stay tuned. Stay subscribed to Utah in the Weeds on any podcast player that you have access to. And you can listen to the podcast on Discover Marijuana YouTube channel, which we are doing a YouTube giveaway this month, coming up on the final week of the giveaway. You need to be subscribed and comment on the most recent video to be entered into the contest. We're giving away free visits to Utah Therapeutic Health Center for cannabis-related healthcare. Also, a Da Vinci IQ2. That is a $300 dry herb vaporizer. Extremely well put together ceramic bowl, glass tube. The taste is better than any other vaporizer that I have tried, and some other swag items too. Giving away. Discover Marijuana on YouTube. Slam that subscribe button. Today's interview and discussion is with Donna Froncillo. She is a Utahn now. She moved here and is a cystic fibrosis patient. She found cannabis. Well, I'll let her tell the story and how many medications she was on and how cannabis has affected her, what she has found works for her. Another really great conversation with somebody who is legitimately using cannabis as medicine in a way that makes sense, in my opinion. Otherwise, I really appreciate all of you. Appreciate you subscribing to the podcast, Utah in the Weeds. Again, my name is Tim Pickett. Enjoy this episode. So, how did all of this, like this process of cystic fibrosis kind of come about?
Okay, so 15 years ago, I had a bout of pancreatitis. And I ended up in the hospital for a month. Well, the doctors were kind of baffled about it because they didn't know why. There was no reason for it. It just came about. I didn't have a long history of drinking or doing any drugs or doing anything that would brought it at my health. My diet was pretty healthy too. Not as healthy as it is today, but anyway, so I was in the hospital for a month. Well, then the following year, I got pneumonia, and I couldn't get rid of the pneumonia. It went on for 16 weeks, and they kept giving me antibiotics and sending me home and giving me antibiotics. And then finally, after 16 weeks, the same hospital that I kept going to the ER, they said, well, why don't we just keep you? And why don't we do some testing because you're not getting rid of this pneumonia that's in the base of your lungs. So that's what they did. They brought a lung doc. What is the lung doctor called? I don't even know. Lung doctor?
Lung doctor's fine. Yeah.
Okay. Okay.
Pulmonologist is the word.
Pulmonologist. That's the word.
Is the word you're looking for.
Right. So they brought him in and he said he was going to do a bronchoscopy. Well, when he went in there to discover what he did, he had to send that, which he said was the worst thing he'd ever seen. But he had to send that to the CDC to be tested to see what was in there. And that's when he came back and said, you have Mycobacterium abscessus. And it came back. And at the same time, I had asked him to diagnose me to see if I had cystic fibrosis because I did have a third cousin who had died from it. And he wasn't going to because I was 42. And he said, well, we'll do it based on family history. And sure enough, I had it and it was positive. And that was it. And then I was on 3 years of different medications to get rid of the Mycobacterium abscessus and an IV. I had the PICC lines for a few months, along with some other oral antibiotics. And yep. So I think there was a straight 2+ years of oral antibiotics after the IV.
Wow.
PICC line. Mm-hmm. And they told me they did not think I was going to make it. They said, this is really bad. This is the worst thing you could have got. worse. And I was like, whoa, I'm thinking I'm going to die. So,
Yeah, no kidding.
yeah.
So
Mhm.
and really cystic fibrosis is it has a lot of effect on the lungs. The pancreas is involved. So this kind of fit the whole picture all of a
It
sudden.
did everything, everything from my sinus problems in my early 20s to my infertility of not being able to have a child, IBS, getting diagnosed with IBS when I was in my upper 20s. My thyroid went nutso when I was in my early 30s.
Yeah.
I was premenopausal at like 35. I mean, there were some weird things going on in my life that I was like, I didn't know. I just was confused for years.
Yeah,
So,
I bet. So when this was how long ago were you diagnosed?
I believe this is 15th year.
Yes.
That would bring us back to what year?
20
2008?
Yeah, 2008 would be 15 years from now or 2007.
I think it was 2008 because in 7 is when I had pancreatitis, and I think in 8 is when I had the pneumonia. And then that's when I found out. And then I finally got Medicare approved in 2010.
So what changed in your life once you were diagnosed and you kind of knew this was the case and you started to realize these symptoms came from a place of this chronic illness that you had?
Wow, what happened? A lot of strange happened. Um, when I was put on these medications, I hadn't been on many medications. I had just been introduced to Synthroid a couple years prior. And so I wasn't really on really many medications. Well, what happened was I started getting side effects, and I was on a new medication. Then I was on another medication. Then I was on another one. Before a 3-year period, I ended up on 19 different new medications. 19. And I just started feeling like I just wasn't me anymore. There was something wrong with me. I was thinking different thoughts. I was having these different moods. I was crying a lot. There were things it just wasn't my normal. And I was on something for going to sleep. I was something on for stress. I was something for fibromyalgia. Then they gave me something for stomach cramping. And then I was on a muscle relaxer. And then I was on, pain pills. And then I was on pain pills. They were giving me like 7 of those a day. And I was just like, it just seemed like I was getting worse and worse and worse. And then so that went on for about 3 years. And finally, and this is in Florida, I had this friend who had come from California. And she said she wanted me to try a marijuana. She called it cannabis butter.
Yes.
So she called it cannabis butter. And she said she wanted me to try a cookie. Well, I did. And I slept well that night. I ate. I wasn't in any pain. I felt like I was normal me again. And I was like,
Wow.
whoa. And it was made of Girl Scout cookies. I'll never forget. It was Girl Scout cookies because I remember asking her, what was the name of that thing you gave me?
Yeah.
And so what I had realized was something was up with that medication. So now I had a dilemma on my hands because now I had this new drug and with all these other drugs.
Yes.
So what I did is I did something that's kind of not normal. I took myself to Tampa General Hospital and I asked them to admit me to the psych ward. And I came with a laptop. I thought I was going to be in there for a week, just a vacation.
Right.
They're going to help me out here. No. It was a different shock altogether when I got there. So anyway, laptop was not going with me. I couldn't bring anything upstairs with me. And they wanted to know why I was there. And I said, I have to get off of all these drugs. And I know I need to do it, but I don't want to do it by myself because what if I do this and something happens to me?
Right. I mean, you're on 19.
It's a lot of drugs.
Yeah. Like you're on more than 10 drugs. There's all kinds of side effects from taking all the drugs. There's bound to be side effects from coming off of them.
Right. Right. And I didn't know what to expect. And so I thought the safest thing would be under medical care.
Sure.
So I went, they admitted me. I saw the doctor the next day and he asked me what exactly I wanted to do. And I told him, I said, I don't need all these drugs. I said, I need my nebulizers. I need my Synthroid. I need, the basics, but the rest of these, I don't think I need these. And he says, well, we're going to have to stabilize you with something. He said, just because this is a lot, we're going to wean you off of. And I said, okay. So we agreed on Prozac, but then I did ask him about marijuana. I said, I would really like to try marijuana. And he gave me Marinol,
Okay.
which it didn't work. It didn't work. And that next morning I told him, I said, that didn't work. That wasn't the same as the butter my friend gave me. So anyway, so I just went through my 5 days. It was a 5-day thing. He did put me on Prozac. He wanted me to stay on that until what further notice, because keep the chemistry normal. So I got out of there. I was relieved. And that was, so basically 12 years ago was when I started using it, which I know a lot of people find that hard to believe. They're like, didn't you use it? Weren't you smoking it when you were a teenager? Weren't you out there? And I was like, no, I grew up in a house where it was bad. And it was, when you grow up learning that this is a terrible, terrible drug, don't ever try it. It'll turn your brains to mush. You're going to kill your brain cells, So I had all this fear about it. And so 12 years ago, so I wiped out of the 19, I would say, because of what I still have to do today, I would say 13 are gone.
Wow.
So that was good. It was good.
You feel like do you feel like you got a little bit of your life back, a little bit of like normalcy back?
Yes. And I tell people that, and I'm like, I know that there's a lot of people who don't understand cannabis, and there's a stigmatism to it. Like, there's still people that I'll approach and they'll say, oh yeah, you just want to get high. It's a good excuse to get high, no matter what. If you're a stoner, and I'm like, you just don't get it. You don't understand that it's more to it than just somebody who just wants to sit around getting high all day long. Anyway, so it seems like I've had to really, like, in order for people to understand it, and they don't want to hear it, or they don't get it. But yeah, I've told people that over and over and over, is that cannabis gave me my life back. And in a sense, I owe that to God, because I believe that God put this here as a healing plant for us. And I'm not a person who can take a lot of medications, because my pancreas now hates pills. It hates anything man-made. It hates processed. It's the weirdest thing. It's like my pancreas is dictating my whole life. And if I take a regular pain pill, I get pain.
Do you?
And I'm like, so what's good is that? I can't do that. If I eat, let's say I decided to eat a donut, it wouldn't be good. I'd be like, so I've had to change my diet. I've had to completely change my diet. I've had to completely change my lifestyle. I've had to add things into my life. And I'll tell you what, they've told me anything that ends with the word itis, I've been diagnosed with. Arthritis, bursitis, tendonitis, colitis, gingivitis at one time, sinusitis. It goes on and on and on.
You're you're a bag of inflammation.
Right. And that's what CF is. And that's the big thing that I wanted to touch base with, is that there's something, and I don't know the mechanism of the drug. I don't know that end of science.
Sure.
All I do know is that it does conquer inflammation. So, and what causes inflammation? I mean, you got your joints, your stress, you've got foods that you eat, medications you take, sugar. There's a lot of things that inflame the body. So you have to, it's not just about, oh, I'm going to just take this cannabis here and I'm going to be fine. There's more that comes along with that. Not only do you do the cannabis, but you may have to also cut back on the sugar, or you might have to stop, drinking the alcohol. I mean, so I just wanted to hit some bases on this inflammation, because inflammation is what triggers cystic fibrosis, and then we end up sick. So if you can control the inflammation, you can control the sickness.
Yes.
And I don't like to be sick. So I have a fight against, my fight is like, what's the term I use? My fight is against inflammation or the itis.
Yes.
My fight against itis.
It's
fight.
It's like a foe, it's like you're going into the ring, and you see this in a pretty complete picture too, because I think a lot of people don't, or wouldn't see this as, cannabis is one part of the solution. It's not the whole thing. It gives you some options. What do you feel like cannabis does for you, for your day-to-day life? Like,
well, I'm an indica person. So it keeps me balanced. So what I do is, I think we discussed this, is what I do is I do tinctures, and I do them about every 4 hours. I'll do 1 ml. And now I bought this one time because I told you I would try it. This was $80. But what I do is I tend to buy this, right?
Yep.
And it's going to sound like not much. I buy this, it's 3.5, and then I take my own olive oil and I actually just cook it on the stove for like 5 hours.
Okay.
And then I make my own little oil.
Yeah, you've got you were showing me 1/8 of flour, right? Of trike flour.
Well,
here.
no, this is 3.5 grams.
Right, 3.5 grams, right, of flour, and then you take that amount, you put it in some oil, and you decarboxylate it. You make your own.
Yes.
You make your own
and then
oil.
And then I take this and I use this and
a little dropper.
And then and it's a 1.0.
Yeah.
And I do that like every 4 hours, and that keeps me balanced.
Do you feel like that's better medicine, or do you feel like that's cheaper for you? What makes you want to do it by yourself, make your own oil?
Well, because honestly, I can't afford $80 a bottle.
So you feel like it's a little bit cheaper to take your own flour, make your own oil, and then that's going to give it a nice.
Well, it's not going to be as strong.
Yes,
it's going to be weaker. So, and I already know that it's weaker, and it is what it is. It works for me, but it works, but it also takes a long time. It could take up to 2 hours.
Yeah.
So doing it every 4 hours keeps it going.
Keeps you level.
That's what I know. Right.
And if it's weaker and you're doing it more, I really like this idea. I really like this idea, especially for you. This is good.
Yeah. And it's olive oil. So olive oil is one of those things that I can actually digest. So because I'm limited with what I can digest anymore. So then I have the other one. Now this deal was a buy one, get one free.
Okay.
So when it's a buy one, get one free, I can do this, and it's more economical for me, and it'll last me a couple months.
Okay.
Now, I also buy another indica, which is a stronger indica than this one. This one is during the day. The other one is going to knock me right out. That one is 1 ml. I take it, and within an hour, I'm out. And it's a 70-30 indica.
Okay.
So it's pretty strong. And it's the same thing. So, but it was a buy one, get one free. And when you get that kind of a deal and you do it cost dollar for dollar, it works out pretty well. Keeps that
for sure.
Keeps it in the budget, so I can afford it.
Yeah. Well, side question. How bad does it smell up your house when you make the oil?
It's a good smell up for about 6 hours.
Then it kind of goes away.
Yeah.
Your house smells like.
But it's about 6 hours. We've timed it.
Have you?
So.
That's funny.
We had to because there's somebody in the house that really doesn't want the smell of the house. They don't really care for it. And so we have to make sure that that person's gone for at least 6 hours so that she doesn't have to smell it.
I see.
So anyway, but yeah. And then now sometimes I still have to use my vaporizer, which, yeah, I like the Da Vinci's. I did go and look at them because I hear you talk. Yeah, I'm hearing you talk about them. They look great. They're great. But I bought something that was just a little bit, it's cheaper and it's faster. And like last night, I had the worst headache. And I had it came on and I ignore it. I can't take Tylenol. I can't take ibuprofen, and aspirin doesn't even touch it. So I said, fine, I'll vaporize. And I only need to vaporize it for like 10 minutes. And then my headache's gone. And then I can go upstairs and I can go to sleep.
That's cool. But same strains you're using in your oil, your indica strains, right? Which are nice.
Yes.
They're good they can be really good for headaches for people. And I like that a lot. I think that's a smart way to do it.
Well, I think that's the medical way to do it. But then, okay, let me see. So here's what I was going to tell you too, is that, so I had to get through a time period of actually being that I wasn't doing something that was wrong. And I had a hard time with my family. I come from a family of law enforcement. So they're not into marijuana.
No.
I'm like that black sheep.
So when you started to use this medically, were they still not into it?
No. That was the funny thing is they all mentioned how well they thought I was doing, and
you're like,
whatever
Donna,
you're doing, keep it up.
Yeah, you're doing great. What are you doing? And you say, well, I'm using marijuana. And they're like,
right.
How could you?
Yeah. They're all in New York State. So,
in New York, they just adjusted their law. They have an open consumption law now. They're one of the only places in the country that you can smoke cannabis. You can smoke cannabis anywhere you can smoke cigarettes. Out in the open. Yeah, the only
in New York.
One of the only places they actually use more. I mean, trivia with Tim.
Wow.
Is they use more cannabis in New York City than any other city in the U.S. 77 metric tons of weed a year goes through that city. Yeah, bigger than L.A., San Francisco, all the California cities. Yeah, they use a ton of it there. And now you can smoke it in public in New York. I got to go I got to go on vacation there just to see this. Just to see it.
Well, I would too. See, because I'm from Buffalo. Buffalo is a whole nother place.
Oh, I'm sure.
It's not even anything like New York City. In fact, New York City would be weird to them. New York City's weird. It's and here's the thing, is like, this is what I've noticed. Now, okay, even medications. Here's the thing, is like even medications that I was on, that caused me severe joints, pain, and edema. Like I'm talking about the levofloxacin family.
Yeah.
The fluoxins. Yeah. So what did I have to, when I called up my doctors during that time, I said, what can I possibly take? I didn't even know what to take anymore. And they said, just get some edibles. I was like, wow. Hey, that was the CF center. So that was cool.
Yeah, that is
so
cool.
But here's the thing, what I noticed that it helps me with. First off, it helps me with any stressful situations. Brings me right back down. My body stays calm. It's all about keeping the body calm for CF. If you can keep your body calm, you won't inflame your lungs. And if you can eat the right foods and get the right nutrition through the pancreas without upsetting the pancreas will stay nice and calm too. But so what I've noticed is appetite, because I have an issue with malnutrition. So I've lost a lot of weight, and now the endocrinologist is actually doing some testing to see what exactly is happening. So sometimes I'll have like no appetite, none. I'll just be walking through the day like, what do I want to eat? What do I want to eat? Anyway, so I get an appetite, major appetite, especially with this one, this Kush, Kush Orange or something it's called. like, who dat orange? That stuff is making me eat all the time.
That's
I'm like,
great.
"Whoa." It is. It's one. If you want an appetite, get some who dat orange. Anyway, whatever. It's who dat orange crush. All right. So appetite, joint pain, colitis, cramping, my headaches when I get them, the insomnia, the stressful situations, lung exasperations, when my bones start to hurt, when I get pancreatitis. When I get pancreatitis, the only thing I can do is vaporize. That's it. There is nothing else in this world. I don't even care. Morphine. Oh, except for when I'm in the hospital and I get on an IV, they have to give me morphine because it's an equivalent to, that's the level of pain. It's horrific.
Pancreatitis can be really, really bad. My background's in GI surgery, and we would admit you, and there would be the general surgery service or something that would potentially admit you. And yeah, that was me. And we would just fill people up with IV fluids and anti-nausea pills and Dilaudid or morphine or just
Dilaudid,
the heavy duty stuff. Because we didn't have access to cannabis. It just is, it's horrible. But you make a really interesting, I believe cannabis to be one of the best medications for pancreatitis. You get the pain control, you get the nausea control, you get a little appetite, you don't get the slowdown in the GI system. I mean, it's as if it was grown for pancreatitics like yourself, you know?
I am in awe. There's so many times that I'm in awe because it was something I avoided for so long in my life. And, you know, I met with I think it was a psychologist at one point, and we were touching base on the marijuana. And where were we going with that? Well, first off, he made a comment that he doesn't believe that it would have affected me in this way if I had been a partaker of it in my youth, that it wouldn't have worked as well because I didn't have a history with it.
Do you believe that?
I don't even know what to think because I'm just saying to myself, I can't believe that I was made to feel like this was such a criminal thing. It's a good medical thing.
Yes, it is. Yes, I agree. I don't know. I don't know if I buy that.
Mm-hmm.
I mean, there's something to that, I guess, if you were to like use a ton of it when you were really young, screw up your endocannabinoid system. Yeah, maybe. I think that's a stretch a little bit. I guess I would say we don't really know is the bottom line.
Well, the other thing too is they questioned me heavily about what it does to me, how it helps me escape. And I'm just like, escape from what? You know, I mean, I didn't know. He said, well, people do it because they have some emotional pains they don't want to deal with. And I'm like, no. See, I'm in pain and I need something for pain. And this is what I take. And there's nothing to escape because reality's going to be there. Reality's always there. How can I escape it?
Yeah, cannabis does not make you escape reality, does it?
That's what they want to know.
What do you want to escape? What do you
Yeah.
No, I'm not. I want to be in the present.
Pain.
Yeah, I don't want pain, but I want to be here. I want to do stuff I want to do today.
Yeah.
And I don't want to feel like crap while I'm doing it.
Right. And so when I've told people, I'm like, then they'll say, oh, well, you just want to get high. Okay. Well, first off, I wake up high. I mean, I wake up and I'm happy to wake up. I'm like, if I take my little blinders off because I wear a mask, I'll take my mask off and I'll see that it's light out and I'm like, yes. So I get up and I'm all excited. I'm already like that. So I have to do indica. Now, if I have experimented because I had to start trying all these different strains and doing these different things because I was so new to it. I didn't know what I was doing. So I was trying some sativa and that wasn't for me because I was like, I was already excitable. I was already high. I already had so much serotonin. I always said I have an abundance of serotonin in me, and serotonin and dopamine. So it was too much.
Uh-huh.
It was so much that it actually gave me the shakes. And I was like, and that's how I had to get to know what worked for me. So I did go through this whole 3-year trial where I was trying this, trying that, vaping this, eating that, rubbing this on, doing this patch. I mean, I did everything. And sometimes I wanted to see if I could do what other people said they could do, which was they said they get a head high, and they called it headband.
Yeah.
And I've tried and I can't get there. For some reason, I can't get high in my head like people describe. And it's always baffled me.
That's very interesting. You're not the first person. You're not the first person I've ever met that has said that. Most people build up a lot of tolerance in order to do that, but there is something about the blood-brain barrier that's not getting crossed, maybe by the THC, and and who knows? And maybe it's just like when somebody describes this to me, I compare it to Adderall or Ritalin. So for an ADHD person, you have all of this neuromodulation that's going up and down and up and down and up and down. And so Adderall will raise all of the signaling up and it levels it out for people. And for people with severe ADD or ADHD, that actually makes them feel more calm. And it actually kind of lowers their sensation of things. And for you, but for somebody else who doesn't have ADD or that, they can take Adderall and it's very stimulating to them. They're wide awake. They think they describe the contrast as more. And so I wondered if it was be the same type of thing. You're using THC and it's actually just becoming a modulator, right? So you're not feeling that head high sensation because almost like you need it. You need it to modulate you. It finds your balance. It makes you balanced. You described that in the beginning. Yeah. You take an indica balance. and now you feel like, oh, I'm me.
Yeah.
Right.
But even if I take more and more and more, it doesn't matter. Wow. It doesn't even matter. It just does. It never mattered. It's never mattered. The only thing that I noticed was if it's more of a sativa strain and I get say I get a 50-50, the only thing that's going to happen is I'm going to laugh a lot. I'm just going to be laughing and laughing and laughing. And that's only if it's more of a sativa. And so that's the side effect. And one time I remember my father telling me, he said, because he knew about the marijuana, because at that time I was making cookies. And he said, if this is the only side effect that you are getting is you're getting the laughs and you're laughing like this and you're happy, he said, then it's okay. It's okay. And it took a lot for my father to say that because of him being in law enforcement. So, because I know he's still anti-marijuana. But he did tell me that, and that made me feel like at that time, that was his blessing, saying, I'm giving you my blessing. Just don't ever drive under the influence.
Yes.
And he's made that clear because he was a recovering alcoholic. He hasn't drank in 55 years. And so, 52 years. And so he's always told me that whatever you do not eat your cookies and put anything on social media and do not eat your cookies and do not drive when you eat your cookies.
This is good fatherly advice. This is very good fatherly advice.
So every time I do have something to say and I did medicate, I'm like, I better not get on Facebook. I'll just stay off.
I'll just wait on this one. We'll wait on this one just a little bit. That's good.
Just in case, because I don't know. It doesn't feel like I'm saying anything wrong or anything, but I have that little voice in me telling me, be careful.
So you don't ever feel like you're really people are very scared when they start cannabis or when they're exploring cannabis that it's going to change who they are when they use it. Do you feel like it I don't feel like that, but to you, Donna, do you feel like this changes who you are at all in a negative way?
No, no, I never even thought about it changing me. No, I when I went into it and I decided to do it, I just wanted to have myself back because myself was gone after all those pills and all those drugs being pumped through me and all that was going on. I was gone, me, the real me, and I just wanted me back. And so even through prayer, I've I pray a lot for every answer I want. And I always get led to holistic approaches. Like right now, I'm studying iridology and foot reflexology. And I also have a lot of data that I've been collecting on foods and the healings of foods and herbs. I've got a collection of herbs now that I'm going to make my own tinctures. Um, and I keep being led into the direction of holistic approaches.
That's really cool.
So, but I've always just wanted to maintain who I was. And this is who I am. And I didn't want to lose that. And that's what I felt I was losing through pharma.
Yeah.
I was losing me. And I wasn't me. And it was really weird. It was a very strange time in my life. And if it wasn't for there was a doctor in Tampa Bay, and my doctor sat me down after this 3-year period of me being on all these different medications, and he sat me down and he said, "I don't know what to think. What's going on right now?" And he said, "I'm concerned about you." And he said, "I'm concerned about how many pills you're on now." He said, "I've been your doctor." He said, "All these years, and you were only on 2 medications." He said, "And I want you to really think about what's going on right now." He said, "Because you're on a lot of medications. And if it wasn't for him, bless his heart, because he's a normal PCP, for him to do that, he really made me stop and think, what's wrong? What's going on with me?" And so he ultimately led me to get my life saved. So, yeah. Yep.
Thanks for sharing that.
Yeah. And he wasn't in the cystic fibrosis community. And see, that was the other thing too, is with the CF doctors, they're normally lung doctors.
Yeah.
So what happens when you go, they start treating your lung issues, but they can't help you with your pancreas, with your kidneys, with your bladder, with your GI. So they send you over to all these other doctors, and they send you here and they send you there, and then they send you to pain management, and then they send you to this. So I had about 9 doctors that I was seeing on a monthly basis for years. And I would bring my sheet of paper, and I kept an Excel spreadsheet of all these drugs I was on. And I would bring it in to each and every doctor down there in Florida. And I would say, "Okay," I say, "these are all the drugs I'm on. This is what I'm experiencing." "Oh, okay, well, we're going to go ahead and give you some Lyrica because this is all sounds like this is a lot of fibromyalgia related. So Lyrica should do it." Then they would just put another pill on me. And then I would specifically ask them, "Well, are these pills okay with that one?" "Oh, yeah, those are all fine."
Yeah.
But they really, really weren't. And none of them said anything bad. They all said moderate, moderate indicator, moderate, mild. But I knew in my brain that something was happening.
Yeah.
So.
Well, I'm so glad that you found yourself again, right? Through this whole experience,
Yeah.
and you were able to,
Yep.
and now you're able to really be an advocate for cannabis as a real medicine with
That's right.
with your own experience. I really appreciate you coming on and talking about it.
Yeah.
It's really great.
especially for the CF people, because, the cystic fibrosis community, they think, smoking. That's what they're always thinking. Smoking, smoking, smoking. I was very fortunate to be under UCSF and Stanford. And UCSF and Stanford in California both do recommend edibles or tinctures or patches. They never ever recommended smoking. but at least they were open-minded enough to say, we can put this on some of our patients can be on this.
Yeah.
But there is a lot of people that don't understand in the cystic fibrosis community that have children or have teenagers or have 20-something-year-olds, that it's not about them trying to seek a high. I'm a mother. I have a 30-year-old, and I know what I understand where they're coming from, but they're also hearing from a mother that's telling them that this is a medication that can help with their inflammation, and they don't have to be in the hospital every other month or 3 or 4 times a year. You know, it doesn't have to be like that. And they don't have to get down to 85 pounds. There's something that might help. Cannabis.
Yeah. Yeah. I appreciate you saying that. And do you have, so your favorite strain in Utah, is it the orange, the Who Dat Orange Crush?
That one's really good for daytime indica use. But the other one I have is it's just a normal kush something sorbet. That's a good one for sleep. Good. That's the one that knocks me right out. So far I'd say that those are probably the two those are probably my favorites so far. And then of course this tincture. It's called myrcene terpenol.
Myrcene terpenol. It's a Boojum tincture.
Yeah, and this really knocked me out.
Yeah, it's strong. That stuff is really strong.
You only need a half a drop of that.
Yes.
And you're out. And so, you know, I don't know if I could ever make mine that strong. I doubt it. Not with what I'm doing.
Yeah. Well, I'm glad that you came on and told your story. That's Donna, this has been really fun. It's very fun to listen to you and your experience in getting off these medications. And
well, thank you for having me.
You bet. For any of you who are listening, you know, Utah in the Weeds podcast, subscribe on any podcast player that you have access to. Donna Froncillo, thanks for being with us today, and everybody stay safe out there.